Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Good morning, everyone. This is AARP, Arizona Hispanic Connection. Today, we are going to be speaking about diabetes. We are going to talk about the types of diabetes, the causes of diabetes, the treatments that are there, the myths, and the whole works. Before we get into the subject, I want to say that this is a platform. We have this radio program, but everything really is on social media. We have a Facebook page, a YouTube channel. We are also on podcasts. And the name of everything is AARP Arizona Hispanic Connection. And what we are trying to do in this platform is to educate. We bring issue experts from the community. We try to bring Latino issue experts. And I think we have managed to do that at least 90% of the times. So we address issues. We have 4 pillars: education, history, believe it or not, health, and finances. A second objective of this platform is to highlight, to celebrate Latino accomplishments. And we have a lot to celebrate in this conversation. We have people that are accomplished, and some already there, some in the process. And it's great to see. I mean, we have a doctor, and we're going to get to that because I couldn't believe she looked so young. I said, she's the doctor? Because we have not met, right? No. And I couldn't believe it that she was the doctor, right? So we'll get into that. And another aspect of this platform is to connect the community. I believe that through education, there are some issues common to many of us, and we connect. So let's get to the subject. I'm going to do a brief introduction, and then when you get to speak, then you can say a little bit more about what you do in your professions. To my left, we have La Doctora Amanda Campos, and she is, I'm going to have a hard time pronouncing this name, but let me try it. She's a specialist in pediatric endocrinology.
Perfect.
Endo or Indo?
Endo.
Endocrinology at Phoenix Children's Hospital. Yes. We have Alejandra Maldonado to my left, and we ask 2 of our dietitians, our guests who are dietitians today, to find a patient. So we're going to be calling you the patient of diabetes. And we want to learn about your experience, because I think when you have a case, you learn a lot. And please feel free to ask questions as we go. Especially you should have some questions. And feel free. Welcome, Alejandra. And then we have Maria Silva. You are an RD. Do you also have the designation of CDE or just RD? Not yet. And I understand CDE means Certified Diabetes Educator. Wow, I got it. I remember it. And then Elvia Liesch, and both of you have been with us before. I want to really welcome all of you. Let me start with you, Doctora Amanda Campos, because again, one of the reasons why we do this show is because we want to celebrate Latino accomplishments. And would you mind relating to us about your profession? What is this pediatric endocrinology? What is that?
Again, thank you for having me. Endocrinology, it's a mouthful to say, but it's a specialty that looks at hormones. Ideally, one of the main diseases that we treat and we help manage is diabetes. Mm-hmm. And the reason for that, diabetes is related to a hormone called insulin. Your pancreas, it secretes insulin, which is very important for your body for multiple reasons. And so we'll go into detail a bit more about that. And then I am a pediatric endocrinologist. So that means I focus on the hormones of kids up until about 18, 21 years of age.
So even though this matter of hormones we're going to link it to diabetes, then hormones pretty much addresses a whole array of other issues.
So there's thyroid, there's cancers, there's fertility, puberty. So there's a whole bunch of hormones that we help manage, but diabetes is one of the biggest that we help treat because it is such a pretty large incidence, meaning that it occurs not only in certain people, but certain ethnicities are kind of a little bit more affected than others. Mm-hmm. And diabetes is one of the main hormone issues that we do treat and manage.
So if I am understanding correctly, endocrinology is basically very broad. and you focus on diabetes, or endocrinology is linked directly to diabetes?
Endocrinology encompasses a disease of all hormones.
Okay, got it. So it's broad.
Exactly.
Broad. Now, tell us a little bit about where you went to school, your background. I mean, you're super young. You're already a doctor. I assume you went to your bachelor's in medical school, and what else? I mean, how is this path? Because for those of folks that have maybe hearing not children, young people, even children, why not, right? But young people who want to learn, maybe they have an interest in this kind of field. What is the path to get there, and how long is it? How expensive?
No, definitely. So looks can be deceiving. I am a little bit older than I look. But I am originally from El Paso, Texas. And so I grew up in Texas. I did my undergrad there. And so to kind of follow along the course, you do your high school, you do your 4 years of undergrad, you do certain additional minors, majors, look at health and also statics or statistics, and then you go into your medical school. So you apply for medical school. Mm-hmm. Usually that's done through a match, and I was fortunate enough to continue to stay in Texas. So I went to my medical school, which is another 4 years at the University of Texas Medical Branch in Galveston. Mm-hmm. And then from there, you decide what you want to do. And I really fell in love with pediatrics. I kind of knew at the beginning that's what I wanted to do. That's how I knew I wanted to pursue medicine. My mom was a nurse. I was there when both my two best friends' children were delivered, and solidified this is what I want.
Wow. Was it difficult? I mean, did you have a life?
That's actually a pretty funny story, because when I was applying to actually first apply to medical school, you have to have people write letters of recommendations. And one of my professors, which I asked for a letter recommendation, looked at my GPA and she was like, oh, 3.9. So you had a little bit of a life.
Okay. It's a sacrifice, I would imagine, right?
It is, but well worth it.
Yeah, of course. Since we're in this celebrating Latino accomplishments, why not? What's the path to become a registered dietitian? And in your case, you are a certified diabetes educator. You took an extra and you're working on that, I understand. What's the path for that career?
So as a registered dietitian, you do the same thing. You have to graduate from high school. You do an undergrad in nutrition and dietetics. Mm-hmm. So it has to be very specific. You can do a degree in nutrition, but unless you have that dietetics attached to it, you might not take enough classes that you need in order to qualify for the internship. So once you graduate...
Is the internship a key, a must?
Yeah, in order to become certified as a registered dietitian, you have to do the internship.
So they won't give you the exam, the state exam, unless you...
Correct.
Okay.
Yeah, so it's kind of like hours that you complete, experience that you have to obtain. And it's nice because during the internship, you get experience in different areas of nutrition. So school nutrition, you can work at a hospital. I actually did one of my rotations at Phoenix Children's Hospital.
Oh, wow.
And then also in the community. So there are different areas that you can specialize in as a dietitian as well. So diabetes, I've worked in diabetes since I've been working at St. Vincent de Paul's Medical Clinic.
And by the way, you do work for St. Vincent de Paul Medical Clinic, right?
Yes. And so it made sense because our population that we work with deals a lot with diabetes, managing it. Prevention is also another thing that we work with a lot. So decided to become a certified diabetes educator. Those specialties require a certain amount of hours, and being able to show that you've worked in that part.
Were you born in this country?
I was.
Did you have a life or somewhat?
I did. It took me a little bit longer to graduate and decided I wanted to become a dietitian.
Do you feel the pressure to practice what you preach when you become a dietitian?
I think so, but I think the other thing that, at least maybe for me, everyone struggles with food. Everyone struggles with exercise, and I do as well. I'm not perfect. I'm human. So I feel like I can relate to people when it comes to those things.
Good. Now, Maria Silva, if I remember from last time, you were born in Mexico. Was it Guerrero?
Guanajuato.
Close. Close. And so for you had to come to this country, and you came when you were a child?
When I was 12.
Oh, so you started in junior high, and was it a little bit more difficult trying to pick up the language, the concepts, and all that?
It wasn't. I think when you're a kid, you're just like a sponge, right? Everything absorbs. And I was able to learn English within a year.
So
yeah.
It took me at least 3. Okay, good. And what attracted you to nutrition and the path? How was it?
Oh, Jesus. So I have a little of a squeaky line to get through nutrition. I wanted to become a dentist. So I started working at St. Vincent de Paul Dental Clinic. And then one day the girls from the Family Wellness Program where Elvia works invited me over to volunteer. And I was like, sure, I have nothing to do. And then they kept telling me, you're going to become a dietitian. I was like, no, I love teeth. And one day I become a dietitian. So they can predict the future.
Okay, good. Now, is it a difficult career? I mean, not difficult in the sense of the studies, but in getting in and finding jobs and all that good stuff?
It definitely is. And when the internship we were telling you about, because there is a 50% a rate of not getting into it, mainly because there is not enough places to do your to be protected at. So any dietitians out there, I invite you guys to please talk to your manager so you guys can take in some interns, because we need more placements for this intern so there can be more dietitians out there, especially Latinos. Right. It's a huge push because there has to be some cultural sensitivity, right? For you to understand where people are coming from.
Of course.
So you're able.
It has to do with diet, food.
Yeah. So you're able to tell them how to maneuver their current situation and not just tell them you can't eat any of that. It's difficult.
Right. And Alejandra, we almost are going to go on a break, but thank you so much for coming. I understand that you are a patient of diabetes and that you contracted this condition very early on. What age?
Yes, I was 13 years of age when I was first diagnosed with diabetes.
Okay. So did that change pretty much your life?
Yeah, drastically.
It made you conscious of many things that probably you were not thinking about, huh?
Yeah, pretty much. It's pretty difficult getting diagnosed, especially when you have 13 years where you're eating anything you want. You're not having to inject yourself to do all this checking. And then you have people, your friends, your brothers, your siblings in general who are just normal kids that don't have to go through that struggle. So then it's like, why me? Kind of situation.
So you have to go through that mental assimilation and acceptance of that fact that your life is going to be different.
Yes.
We're going to get more into your situation. I also understand that through Maria that you're in the nursing program or pursuing a nursing career.
Yes, that's correct.
That's good. What motivated you to go into nursing?
My diagnosis of type 1 diabetes.
Wow, that's amazing. And are you in high school, college?
In my third year of college.
That's pretty close. She's going to become a nurse fairly fast. That's great. Congratulations, and thank you for being here. We're going to go on our first break. Stay with us. This is AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you for staying with us. This is AARP, Arizona Hispanic Connection. The subject today is diabetes, type, causes, and treatments. You know, pretty much all of my mother's siblings have diabetes. My grandfather on my mother's side had both legs amputated. So there's definitely diabetes on my mother's side. I actually have, that I can think of right now, just one brother who has diabetes. So let's get into that. So does that mean that some people are just born prone to have diabetes? Is that the case here?
So it is partly the case with type 2 diabetes, and the reason I specify with type 2.
Can you first explain the difference between type 1 and 2?
Well, first, diabetes is really just when your body doesn't have enough insulin to keep your blood sugar controlled. And so that's overall the general what diabetes is.
So it's all about the sugar in the blood, could you say?
Yeah. So essentially what happens is every time you eat, your body makes what you just ingested and turns it into sugar. The reason it does that is your brain particularly needs sugar for energy. Other organs use it, but they save it for the brain since that's its primary source of energy.
Is that what the body does?
Your body's very, very smart.
That is unbelievable.
And it knows how to fine-tune. So even when you're not eating, your body knows how to store that sugar in your liver and break it down. So when you're not eating, your brain always has a source of energy.
The body knows to give priority to the brain.
Yes.
That is
your body's very smart.
Yeah.
It tries to save the most important one.
So the the pancreas is an organ that releases the insulin?
Yes. And so what happens is every time you eat, your body knows that you're eating. It knows that you're going to be digesting and making sugars. And so your pancreas then releases insulin so that can move like almost like a little taxi cab, that sugar that's now in your bloodstream to where it needs to go in your body.
Okay, so it moves it from the bloodstream. And that's when the problem begins to happen then, when that sugar stays
In the
bloodstream and is not being pushed out to the cells.
Exactly. So what happens?
That's literally diabetes then.
Essentially.
Okay.
And so what happens is that all that sugar, that energy stays in your bloodstream, and it gets to a point where you need to get rid of it because it's not going to where it needs to go. So eventually what happens is you pee it out. And so a lot of times the first symptoms people notice is that you're starting to pee more frequently throughout the day, or even waking up at nighttime to go to the bathroom to urinate. And so the other thing that happens is you also get dehydrated because your kidneys can only filter out so much of that sugar. And so eventually what happens is you just keep peeing out to try to get rid of it. So you get dehydrated and you start drinking a lot. So usually those are the first symptoms people notice.
So basically, again, the sugar gets to the bloodstream, and then the insulin pushes it out to the cells.
Correct.
When that process is altered and is deficient, then the sugar stays in the blood, and that's when problems begin to happen.
Exactly. And the other portion of that is all that energy is still in the blood, and your body still needs that energy. And so what it tries to do is it tries to make insulin. It thinks you're starving, or so it tries to make sugar, not insulin, because it thinks you need energy that you just can't get to. And so then that raises your blood sugar even more.
And so is that process of the body trying to get its sugar from somewhere, can that affect other organs perhaps?
Yeah, it particularly is more important in type 1 diabetes. So I'll talk a little bit about the two types. So there are different types of diabetes. The main ones that we see majority of the time are type 1 and type 2 diabetes. So I'll talk about those. Type 1 diabetes is like going back to your question about genetics. Are some people just prone to it? With type 1 diabetes, there have been studies that show that certain people are just kind of predisposed to it based on your genetic. There's these factors that are called essentially markers on your blood, and certain people are at risk for it. And when I say at risk, it's a two-step process. So even if you're genetically at risk to develop diabetes, it's not a guarantee that you will. So for example, if you have siblings that have type 1 diabetes, your risk of developing is maybe 5%. And so there's a 95% chance that you won't develop diabetes even if you are at risk for it.
Okay.
And that's with type 1. Type 1 is a different type of process where what happens is your immune system that's there to protect you gets a little bit confused, and it goes to the cells of the pancreas and starts destroying them because it thinks it's not part of the body. And the reason that's important is with type 1 diabetes, you lose the ability to make insulin.
Wow.
So eventually you can't make it at all, which is why the only treatment is to give that insulin back with injections. With type 2 diabetes, it is a little bit more genetic predisposition. So a lot of times this will be like you have your uncles, your aunts, your grandparents that have diabetes, and then you see down the line more and more people may be developing it. So you do have a much stronger genetic risk with type 2 diabetes. But it kind of also follows like kind of this two-step process. So even if you're at risk for type 2, doesn't necessarily guarantee that you'll get it. That's where really kind of weight, if you're overweight, that's a large risk factor for developing type 2 diabetes, and diet.
Right. So Alejandra, she looks
Very thin, yes.
and she has diabetes. So then in her case, it was just genetic. Yeah.
It's a combination. Like I said, it's that two kind of hit factor. So you're at risk for it. And then for reasons we're not quite sure, that immune system gets confused. There are studies looking to see why this happens, what that second trigger is. Is it an infection? Is it something that you're exposed to in their environment that causes your body to eventually recognize those cells of the pancreas not part of itself anymore and destroy them?
Wow. Now, how demographics, race play a part into this? Do we have some numbers? We were looking at the, what is it called, the Centers for Disease Control, which is, by the way, an excellent website that we recommend anybody who wants to learn about these issues. What are the numbers? What did the numbers show, Lydia? Elvia, sorry.
No, it's okay. And the CDC is always a great resource. The American Diabetes Association also has a lot of information that's very valuable. And at least ethnicity-wise, race-wise, the race, ethnicity that's at higher risk are going to be Native Americans, with us following along, Hispanics. And this is for type 2 diabetes specifically. The risk factors for type 1, like Amanda mentioned, is a little bit different. And then African Americans come after that, and after that is Anglo Americans.
Yeah. The Native Americans, I'm looking at the same information you are looking. 15% of Native Americans get hit with diabetes. Asian is 8%, Hispanic is 12%, and black non-Hispanic 12%, and then white non-Hispanic is 7%. But it was interesting. I was looking at that this is 18 and up, 18 and older. When you look at children, that the thing changes. And let me see if I can find it real quick. By the way, Arizona is high, very high in with diabetes percentages. Here it is. So this is age 0 through 19. The white is 27%. So 0 to 19, the white population is higher. This was totally surprising to me.
It's probably because it's type 1.
Type 1s. That's very important too. Yeah, thank you for that.
Yes.
Thank you, Maria. That is very important. But still, it's still a high percentage for white folks. Alejandra, can you share with us how did you know that you were diabetic?
Well, I started having symptoms as, like the Dr. Amanda explained. I was frequently going to the bathroom, waking up during the night to go to the bathroom, drinking water. I wasn't the typical teenager who was sleeping in the couch. I would always be outside playing or on the phone or bothering my mom, doing whatever it was. So when the symptoms started, she thought I started losing weight. So she thought maybe you're doing drugs or blah, blah, blah. I was like, go ahead, test me. I'm not doing drugs. So then she ended up taking us to get a physical where everything came out fine. But they did send me to get a blood sample where the following day they told her to take me to the hospital immediately because my blood sugar was above 600.
That is amazing.
So anytime I could have just fall, faint, and just stay there. Actually, that day, I had just gotten out of physical education. So without me knowing I had diabetes, I felt dizzy. I was about to fall. I call my mom, and she starts crying. She's like, I need to take you to the hospital. I'm like, I'm fine. What are you talking about? Like, no, I'm okay. She's like, yeah, I'm going to go take you out. I was like, no. I only had 30 minutes of school left when they actually picked me up and took me to a clinic where they actually diagnosed me. And when they diagnosed me, it hit hard, as in the sense that the doctor, when she told me, she checked my blood sugar. It was 500 and something.
Wow.
And she basically told me, she was like, oh, I see you're not from here. You're born in Mexico. You should just go back because you're not going to get help. You're just going to basically die here.
Wow.
But if you take care of yourself, you'll live a little longer. So I'm like, okay, my mom's ready to leave. I'm like, no, I'm not leaving. Like, I came here since I was 5. I was 13, so I was like, I'm not leaving.
Those words really penetrated your being to the point of literally, the thought came to just go back and die, literally? Or just go to Mexico?
My mom wanted to leave to Mexico to, since I'm Mexican. Yes, okay. Since I'm Mexican, they would help me there.
Okay.
But here, since I'm not from the United States, it would be difficult for me to get help.
Yeah. And this brings us an amazing point, Maria, that how critical is being educated, right? Because if you're not educated, you have all these weird thoughts and it can really put you in a panic mode. How critical is education?
And giving the benefit of the doubt to the doctor, maybe the doctor was legitimately worried. And she's like, there's not going to be a lot of resources right here. Maybe the best is for you to go back home again. Benefit of the doubt. So let's believe that was. But I can definitely see your mom, like at that moment of, what am I going to do? We need to go back. I want to save my child. So education is definitely very important in every way, from knowing how to react, knowing the resources out there. For example, now we have big stores that provide insulin at low prices. We have clinics like the St. Vincent de Paul that provides both, not only the education, but also the medication to try and help families go through. And there is a lot of pharmaceuticals out there that can also help supply this medication at a low cost.
If somebody doesn't do the routines annual exams, what should be they looking for? in terms of warning signs?
And I'm going to do a little plug right there. It's very interesting that when people don't do the annuals or just going to the doctor regularly, when they do go, they get hit with a bunch of diagnoses because they waited so long. That now, so it wasn't that you go to the doctor and they give you bad news, is that you were not proactive about your health. So, one of the signs is like Alejandra was saying, frequent urination, weight loss, excessive hunger, not fatigue, being excessively thirsty. So anything that sounds to someone that is like just eating a lot but keeps losing weight, and that's huge, I think. And with the statistic that you gave right now, with Anglos being at a higher risk for type 1, and you can correct me, Dr. Campos, I feel like now we're seeing type 1 more in Latinos than we used to in the past.
So, so both type 1 and type 2, those lines are being blurred now. And so, yes, a lot of times, so for example, if you look in Finland, the majority of diabetes is type 1 diabetes. So we are seeing this autoimmune process kind of occurring in different nationalities. And we're also seeing type 2, which used to be really a diagnosis once when you're older, being diagnosed as an adult. Now, the youngest I've seen is an 8-year-old being diagnosed with type 2 diabetes, which before was almost unheard of. We would have initially thought this is type 1.
Right. We have to go on our second break. Stay with us. This is AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you for staying with us. This is AARP Arizona Hispanic Connection. A lot of times when we talk about diet and losing weight, I hear a lot of different opinions. And my own personal opinion is do whatever exercise you want, but unless you control your eating, you're not going anywhere. That's my philosophy. Yes, unless you're a bodybuilder, you're like doing 3 hours a day of exercise, you will see a big difference in your health. But if you're just doing your 45-minute walks, etc., it's great for your heart, your lungs, your blood, but you're not going to see a big change. If you want to see a big change, it's in the food. So I say that because when it comes to diabetes, I'm kind of getting this concept that if diabetes is being diagnosed at such an early age, what part does food play into this? Because unless we pay attention to the food, I don't know that we're going to make a lot of progress. How's food in this arena?
So a lot of things I like to tell my patients is the first line with diabetes is changing diet. Even with type 1 diabetes, where your body just doesn't make enough insulin, you still need to have a well-balanced, healthy diet because your body still needs nutrition. The only difference is with type 1, you're giving insulin to cover the sugar that you need to eat. Type 2 diabetes, again, is much more related with diet and weight. And so it's very, very important. So I go back to kind of food being a medicine because a lot of times there's two different schools of thought. With type 1, a lot of times people think, well, if I limit this, then I don't have to give as much insulin. Or the other school of thought is I can eat whatever I want and I just can give insulin to cover it. And that's a very double-edged sword. You don't want to be in either extreme. Food is an important source of fuel. It's an important source of nutrients, so we need to give our bodies a well-balanced proportion of that. And so, especially here and culturally in different areas, food is very important. Sometimes food is love, and the types of food we're given may not always be the healthiest. So, for example, foods that are very sugar heavy or carb have a lot of corn syrup. There's a lot of talk, and I won't go into too much detail of it, but like corn syrup that we use here in the United States, a lot of times can affect your brain's ability to sense that you're full. So sometimes you overeat. Other things that I see a lot of times that we do is we drink our calories. And so we give a lot of sugared beverages thinking
What do you mean,
that
drink our calories? We're supposed to get calories from solid, but then we're already, they come in liquid form?
So, for example, let's say you're going to have your meal and you drink your 32-ounce soda. That's a lot of sugar and calories that you just flooded your poor system with. And so your pancreas is working on overdrive to make that insulin to cover it. And then instead of eating what could you gotten for the same amount of calories with fruits and vegetables and protein, you drank in this 32-ounce liter of whatever sugared beverage you decided to drink. And so you're giving all this extra calories, so your body is going to store it. It's going to store it as fat. And when you store fat, and that's the reason weight is related with type 2 diabetes, is you're increasing the resistance to your body's ability to use insulin appropriately. So it's there, but not working great.
Now, from the dietitian's point of view, how do you go about having the conversation? I assume that you don't diagnose a person. They come to you with a diagnosis already. Mm-hmm. How is the process of the dialogue and the approach and the action items that you're going to need to recommend?
So when I first see a patient, we really start the conversation about, this is what diabetes is, this is the risk factors and potential reasons why you were diagnosed. And I really emphasize there are certain things you can control. Mm-hmm. And one of those things is diet and exercise. The other things, genetically wise, you can't kick grandma out of the family because she had diabetes, right?
Right.
So I really emphasize that at this point, you can live a really normal life with diabetes. It's just a matter of working towards those behaviors that are going to be healthy when it comes to eating and exercise.
Mm-hmm. In your experience now, you deal with not just diabetics across the board, patients, or just with diabetes?
With anybody that needs any kind of nutrition, but our specialty, or it's big in our specialty is diabetes.
How do they come to the clinic that you work for?
So at St. Vincent de Paul, they go through the medical clinic, the medical provider is actually who does the diagnosis.
So they came to the clinic to do a general exam. They did not know what was wrong with them, and then they end up with...
That could be one of them. Yeah, just like Alejandra, who went to the clinic and was diagnosed there, they can do that. Oh, there is someone that knows that they have diabetes, but they don't have medical insurance, and they'll be coming to the clinic. Okay. So then they get a referral to us to be treated. To be treated for anything, whether it's they just need general education and diabetes, which is where the CDE comes in and can provide that, or if they just need straight nutrition information.
So does that mean that diabetic is a little bit more stricter? It's more of a specialty?
I think that at the clinic, we don't treat it as a little different. Okay. I think we are to the thought that everybody needs to have a very diabetic-like diet. Okay. And I say that with quotations because it is a very healthy diet where we recommend eat your vegetables, don't overeat in carbs, and watch on your proteins. And eat a lot of vegetables with a lot of water.
The other day, my wife had tamales at the house, and that's all she had for breakfast. It's just, but too much masa, right? So I said, that's okay, just dump a whole bunch of vegetables. And she did. Oh, wow, that did it. Someone even says that even if you have to eat a slice of pizza, that's fine, but mix it with vegetables. Can you help us understand then, in the process of a professional, a doctor, with a dietitian, is there a coordination of care where you send it to them? Or are you able to treat patients even when, in this case, a doctor like her is not in the picture?
So we work very closely with our dietitians. They're kind of like our right hand. They're very helpful. For example, in Phoenix Children's, we have an actual type 2 clinic where we work with, they see a physician and they see their nutritionist as well. And a lot of times we have a psychologist as well, because having diabetes, especially when you're younger, is difficult. It's frustrating. It's time intensive. It's inclusive. And again, going back to that whole, I look at your diet almost like a food. With our type 2 diabetics, a lot of times you can get good control with just diet and exercise, and may even potentially come off medications.
Mm-hmm. Really?
Exactly.
Amazing. So I assume that would apply to pre-diabetic. So a pre-diabetic can, if they do exercise, they lose weight and adopt a good nutritious routine, they may move out of that.
With pre-diabetes, so you're not diabetic yet, but you're at risk for it. So a lot of times you can see your blood sugars may be running a little bit higher, but not abnormal. And so they look at different blood markers to detect that. They look at your family history, what ethnicity you are, and your risks, essentially. But ideally, yes, if you control your weight, your diet, there's that potential removing of that second hit process. So maybe you won't develop full-blown diabetes. Once you have the diagnosis, you do have it for life. Even though if you great control and manage and start control with diet and exercise, you will always have diabetes. But managing it is what's important.
So you basically, let's say you worked at a hospital where you have patients. Does the the dietitian literally prescribes diets, correct? Once you hear the diagnosis?
Yeah, I mean, basically, they send them to us so that we can have those conversations about food, that we can have, and oftentimes it's more about changing those behaviors. It's how can I go from 10 tortillas a meal to 2 tortillas? Like, it's really hard. How can I take away that soda?
Right.
So oftentimes I find myself feeling like a counselor because we talk about food, but it's more about those behaviors.
Okay, okay. Coming to you, Alejandra, I have to believe that the greatest lifestyle changes that you have made has to do with diet, perhaps. And what has been the experience like? Are you missing things, or you still eat of everything but in smaller portions? I mean, how's that experience of having to change your Mexican diet?
It's hard because then it's not just on me. It's if they're eating it, I can probably crave it or be like, oh, I want some. So then again, they have to, as a family, we have to all pretty much change everything.
You have siblings?
I have 3.
Okay, so does that mean that you prepare two dishes separate, or they have to adopt to your diet now? Which would be great, I think.
Well, at first it was like, oh, you have to eat. Well, I would eat what they would eat, but just smaller portions.
Okay.
And to me, that was like, what am I eating? Like,
Right.
I wasn't used to eating that much of a little bit of carbs or counting my carbs. And then they're just eating and they're eating and they're eating and they're okay. But with me, I have to actually go and do an injection. So I have to be more cautious about what I'm eating. So, yeah, I guess I would put more vegetables.
So sodas, did you do away with sodas? No more sodas anymore?
I only drink them now, basically, when I get low blood sugars.
Okay, that's
So
a way to move your levels up.
Yeah.
Okay. How about other, like chips? You know, that Mexican, ¿cómo les llaman? The one that the Mexican kids eat a lot of? Chetos and
los
Cheetos
Takis.
and Takis? All that. Is that something you used to eat or not?
Before I was diagnosed, I would always have chips at the house. In case we were watching a movie, I would always be eating them, and I would put extra chile on them.
Okay.
But yeah, I would say I tried not to eat them, but it's sometimes like my brothers have them, and I'm just like, I'll just get one.
How
And
about
then from that one, it turns to more
To
and
2
more.
and
So I'm
3?
just like,
Yeah.
I need to stop. So
How about eating out? Because this is another big issue, you know. Eating out, it's pretty interesting. Is that something that you have to be careful as to where do you go, what to eat, and all that, and portions and all that?
I actually, whenever they go out to eat, I will probably eat the same thing that they eat, just probably less, and whatever's left over, I'll just save it for later or just give it to somebody else. But yeah, it's pretty hard since I have to make sure what I'm eating and I can actually find how many carbs it has.
Yeah.
Because if I don't know how many carbs, I don't know how many units of insulin I
So
have to give.
are you more aware of counting the calories and all that?
For type 1, I believe like carb counting is key because your carbs, to me, when I was first diagnosed, they explained to me that you shouldn't look at the sugars, you should look more at the carbs because the carbs is what you need to give your insulin for. So they do give you a carb ratio. So for 1 unit for my carb ratio is 24. So for every 24 grams of carbs, I have to inject 1 unit of insulin.
Now, the social life with your friends, is that affected as well? Because, I mean, if you have friends who are just eating whatever and then you go with them, is there a change in that relationship with friends necessarily or no?
When I was first diagnosed, I was actually like, well, I can't go out. I'm like, how am I going to go out and then in publicly, like, poke my finger and everybody's just going to be like, what is she doing?
Right.
Or when you're doing your insulin out in public, since I do syringes, it's like, what are you doing? And it's hard because then everybody's just looking at you and staring. And then it's like, you get embarrassed or it's just, that was me at first. Now I'm just like, okay, like
So
I'm a
you
type
still
1
go
diabetic.
out and socialize normal?
Now I do.
Okay.
Now I know that I can do things as long as I am taking care of myself and I am doing my stuff as I'm supposed to.
Thank you. Let's take our last break. Stay with us. This is AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. We are addressing diabetes, the types, the causes, and treatments. We have issue experts with us. It's been a great conversation. I think this is a very important issue. And off the air, we were talking about how there is a different approach to when you have a diabetes type 1, which in most cases or every case you have to have insulin injected, correct?
Correct.
In type 1. But then in type 2, not necessarily, because my mother has type 2, but she does get injections of insulin. So is the approach for diet different? And then let me just throw the concept here. Do people cheat with the insulin stuff? Is there a way to deceive your body, so to speak?
So I'm going to let the cheating part be talked by Dr. Campos, but I'm going to talk about how it is different, because for type 1, you do need to know the carb content of your food. So when you go to a restaurant, there's restaurants like chain restaurants that can just give you, so this meal has, and they give you a nutrient composition.
Right.
But there's other restaurants that, like, smaller, like mom and pop restaurants that don't give you that. So you have to figure out, like Alejandra was saying. So for a type 1, you need to know how much carbs you're having so you can inject the insulin. For a type 2, you need to
does that mean she has to have an amount of carbs, and she has to make the combination with the food and the insulin?
Right, because
Really?
she needs to cover her carbs. She needs to inject insulin to cover her carbs so that her body can actually work properly. For a type 2, they need to look more heavily on the nutrient content of them. Type 1s definitely have to also look at the nutrient content and make sure they have nutrient-dense foods. For a type 2, though, the approach is slightly different. So a type 2, we definitely push more on the balance and, the exercise and the lifestyle. We're heavier on it. Type 1, definitely. We're not going to forget about that. But they do have to be careful with the knowing how many carbs they have, or they will have to chase those blood glucoses.
So type 2, you still produce insulin, but not sufficient. Whereas type 1, you're actually not producing the insulin. So everything, the insulin has to be injected pretty much completely.
Correct. Type 1 is you're actually deficient in insulin. Your body just can't make it anymore. That pancreas has now been pooped out, essentially, because your immune system attacked it. Type 2 is your body still makes some insulin, but it just doesn't use it as effectively, so that you can't keep your blood sugar well controlled. And there's also other associated risks to it. With type 2 diabetes, having that high blood sugar, and we'll go back on how diet is so important, is you're also at risk for other things. So if you have type 2 diabetes, you're also likely also to be overweight. And so you're at risk for other things associated with that. So heart disease. Diabetes is a risk factor for heart disease. So having both diabetes and obesity is like a 2-hit. And then you're also at risk for kidney disease, and also at risk for poor perfusion. So what happens is you actually have changes in your blood system, like your vascular system, which is why you can have blindness, why you have to have a yearly eye exam. You can also have poor perfusion, meaning you're not getting enough blood supply to certain areas. And a lot of times you can also have your nerves be affected. So this is why a lot of times you see like your family member that had to have their legs amputated. What happens is you can't feel that kind of trauma that normally, if your nervous system was working appropriately, you'd say, oh, I have a blister, this hurts, I'm not going to use it as much. With diabetes, if you don't have that pain signal to tell you, you might just keep re-injuring it. And you have high blood sugar, which causes bacteria to grow. It's a good culture media. And so that's how you get this infection. And then you can have worsening of the disease where you need to have amputations, or eventually can also have blindness as well because of those changes to the vasculature behind your eye.
And the cheating part, how do people cheat with this?
And so I'm just going to kind of preface this with everyone should have a very healthy, well-balanced diet, whether you have diabetes or not. You should be eating most of your energy, and your nutrients should be coming from vegetables, fruits in place of juices or these Powerades, Gatorades, because they have more sugar and less of that nutrient. And so with someone with diabetes, if you're type 1, diet's a little bit different. You should still be having a healthy, well-balanced diet, but the only difference is now you're paying particular attention to carbohydrates, which get broken down into sugar. And the reason you're paying more attention to that is because you have to give insulin that your body normally would have given for what you're eating, but it can't anymore. So you calculate what it should get, and that's why you give it. With type 2 diabetes, your focus isn't so much on carb counting so I can give insulin unless you're on it. It's more about dividing your plate so that the food that you're giving is getting a good amount of nutrients and energy, and not just all carbohydrates. So that's meaning you're eating tortilla, your pan, your pasta, all these other things are just very carb heavy, which have calories, but they don't have that balanced nutrition. And so the way your body processes the type of foods you're eating differs. If you're eating carbs versus if you're eating meat, a lot of times you can feel fuller with proteins, and why there's these so many variations in diet.
Right.
And then going back to how people cheat is a lot of times people think, well, I'm already on insulin. I can't get any worse, so I'm just going to eat anything I want, drink soda, and if my blood sugar is high, then I'll just give insulin for that. But it's a balance. You can give insulin, but insulin isn't a magic bullet. It won't fix a bad diet, even if you have diabetes.
So basically, they get all this sugar in the bloodstream, and by injecting the insulin, then it pushes it out, and they can somehow get away with this amount of extra.
What the
stuff
insulin's
that they
doing is
ate.
pulling that sugar out, correcting it so that can go to where it needs to go in the body.
I see.
But if you have that kind of thought process and you're always running your blood sugar high, that's not good for your body as well. You want it to be in good control.
You know, I think it's very important that we address the issue of drinking, because there's a lot of people who drink not socially. I almost don't believe in social drinking. Most people say it's social, but they drink every day. But anyway, that's another subject, right? But there's some people who enjoy the drinking. What happens when somebody contracts diabetes? That combination of diabetes, drinking, can you address that at least briefly?
Sure. With diabetes, it is a little bit more dangerous, particularly with type 1 diabetes, because anything that you're drinking with alcohol has sugar in the form of carbohydrates. So it's very difficult to give insulin to cover for that. And then if you're drinking to the point that you're getting drunk, then that becomes very dangerous if you have type 1 diabetes, because now what essentially happens is when you go through that process, your body's clearing out that alcohol. It's raising initially your blood sugar, but then what happens is you need to use sugar and energy to get rid of that alcohol and eventually no longer be drunk. And so what happens is then you can be at risk for low blood sugars. And with type 1 diabetes, that's particularly dangerous, especially since it alters your perceptions. And so let's say you are drunk, you're becoming low, you're at risk of going into like a coma. And so it becomes particularly dangerous. So that's just something to kind of keep in mind, something to balance, to have healthy. No one really should be drinking. It's not that you need it for your body. I know some people enjoy it socially, just to do it with that grain of salt behind of how to keep yourself healthy.
You know, I'm not going to mention names, but when you watch sports, there are opportunities linked to the game. You know, a touchdown, you can go and get this, and they score this many runs, you can go buy that. And it's to me, it's amazing how they can invite people to go and buy stuff and link it to the game. And there's one particular that calls my attention a lot. You get this amount of this food with the purchase of this other thing, and this other thing is extremely expensive, which pays for the other things that they're giving you. But more than that, it's extremely unhealthy because they're inviting you to drink. I mean, I cannot believe this huge sodas. I mean, what is that going to do to you? That somebody's hooked to something, you know, because normally you would not want to do that. I got into the habit of not ordering soda when I go out to eat. I do not drink soda. I don't order it. And then at home, I don't include my liquids with my food. I do my liquids later. I don't know where I picked up that the saliva plays an important part in the digestion, and then maybe you want to drink your liquids, later on. We just have a couple, 3 more minutes. Can someone talk about the Mexican diet? I mean, a lot of people seem to have issues with that. Anybody?
Well, first of all, I think it's important to understand that diet is more about making healthy lifestyle changes. And I always emphasize in our classes with our patients that it's not that you can't have something, but you want to have it in moderation. And you want to make sure that you have that balance. Just like your wife, she had those tamales. Mm-hmm. I would never tell anyone you can't have tamales. Mm-hmm. But we just don't want to have too many tamales in just one sitting. Mm-hmm. And I think your suggestion to her of adding those vegetables was very important. So when you look at the Mexican diet or any diet, you don't want to be like, that's a bad diet. This is a good diet. It's not about which is bad or good. It's about where are we eating too much of? What are we missing? More often than not, we're eating too much carbs, too much fat, and often we're not eating enough vegetables. So if you can find that balance, think of any meal. and say, I have a little bit of this, I have a little bit of this, I made sure to include my vegetables, you should be fine.
Okay.
People overcomplicate the diet part.
Okay. Any final thoughts, Doctora Campos?
I was just going to kind of add to that as well. What you're saying is very important. Tortillas aren't bad. Breads aren't bad. But if all you're eating is, instead of having like your 2 tacos, you're eating 12 tacos or mostly enchiladas, like that's when you're crossing the line of this is now too much of a good thing.
Right.
And so, yeah, you definitely want to have this idea of balance, this very much of balancing what you're eating, balancing what you're drinking. Also kind of going that I never like also saying that you can't have something. You can have soda, but it really should be in a special occasion. It shouldn't be a special occasion every day.
Right.
How about
and in
yourself?
your case, the diet, are you practicing those kind of principles? Do you have your Mexican diet? You just kind of balance it? Have you had to give up some things? How is it in your experience? We have about a minute.
I haven't actually cut out everything completely. I just mixed more vegetables, or instead of drinking soda now, right now I'm just drinking water every day, constantly. It's just water, no more juice, no more soda. So
do you miss it? I don't think you do once you get used to it, right?
once you get used to it, you don't really miss it.
Right.
But then if you have one sip, it's like addictive. So then you're like, I need more.
Right.
Because it's like, and especially if it's cold. Like, it's so good.
La Coca-Cola bien helada.
There you go.
Right.
Yeah.
And so basically what you're doing is basically, again, balanced diet, but for the most part, just eliminating the really, really bad stuff.
Yeah.
But then the others, you just kind of have
Minimizing
more
your tortillas.
Yeah, we typically have my 2 tortillas, and that's max, and we don't have it every day. Anyway, I think a diet, it still has to be the main, the pain point, so to speak, where we have to pay attention. And this doesn't have to be because you're diabetic. This is across the board. We all have to be very careful because the way the foods are produced these days, it's pretty crazy. There's a lot of production going on that doesn't think of our health. They just want to sell. And we have to be smart. And I think what I gather from your sharing is education. Final thoughts? We've got to go.
Yes, choose small. Do not supersize. Just go small with everything. That's what I recommend. Just small with everything. Do not double anything. Do not double stack. Small.
Get used to small portions.
Yes, the small.
Perfect. Thank you. We come to the end of our show. I want to thank our guests. Thank you very much for coming and giving of your time. This was AARP Arizona Hispanic Connection. Have a great week.